My name is Dr. Kathleen Murphy. I'm a fellow of the Association of Music and Imagery, and I am also the program director for Music Therapy Graduate Studies at the State University of New York at New Paltz in New Paltz, New York. I've been a music therapist for over 35 years and have been working primarily in addictions since about 2000. My work in addictions has been in short-term care, and I've also worked in longer-term care with women and most recently with infants who are withdrawing from opioid exposure. I'm excited to be sharing with you ways of using songwriting in recovery, in treatment for people in addiction. And so today we'll start with a brief overview of music therapy in recovery, working in a facility that has a 12-step approach. And we'll look at outcome-oriented models of songwriting and experience-oriented models of songwriting, as defined by Felicity Baker in her recent publication, Therapeutic Songwriting, Developments in Theory, Methods, and Practice. By the end of this tutorial, you will be able to select songwriting forms that meet client need and fit within a variety of theoretical orientations and treatment models. So you can use songwriting in a way that fits the way that you practice and the way that the clients will be most likely to benefit.